In Premier and NeuTiger, we are working on an AI solution to understand the specificity of your population and segment which are at risk, right? This is totally innovative, and I believe Patient Premier is among the pioneer in the healthcare sector to look at AI to unlock the value of its data. What are you trying to solve exactly with AI?
Sure. I think the best way to kind of think about it is this is the next step in documentation. When we kind of said, well, the current standard of care was either verbal or written, kind of questions. And let's just kind of make an example. When a doctor asks you, how is your pain, between a scale of 0 to 10, 0 being no pain, 10 being the worst pain that you've ever experienced. And then that was at an office visit across many months, and there wasn't touch points in between. That bridges an opportunity, and that opportunity can even cause harm to a patient when you're not having those kind of better data points, better understanding what's happening in between visits. And when you have to kind of see the whole picture, the whole patient. You need to understand their background, what's happening at home. You have to understand what their support systems are, what the quality of life is, what their functionality is. And there's so many different domains within pain. It's not a single number. And that's AI, these kind of AI tools over time kind of help us identify, let's give an example, better or the best treatment for an individual. That would be, one of the kind of goals or ideals here. And it's not going to just happen tomorrow. It's an iterative process, and we have to make sure that we're benefiting the patients first. And that was an interesting thing that we had as a first premise, was that a lot of the AI systems in practice now are obtuse, and they're just have a mystique surrounding it. And the core kind of tenet of what we wanted to do was we wanted to provide the same insights between what a patient was getting and what a doctor was getting, and their whole care team would share in that, and the patient themselves. We wanted to make sure that there was a balance there, that what was being assessed and what was being reported was seen by all parties.